Welcome back. State data shows that black women in Massachusetts are nearly 2 times more likely to die during pregnancy or within a year after giving birth. As our Emily Maha explains, a pilot program in Boston gives some new moms more support when they need it the most.
All the food is made fresh, not frozen.
Fresh herbs added to perfectly portioned meals packed up and delivered right to your door.
As a mother of 2 myself, I know how vital and how hard, I guess, the postpartum period is, like mentally and emotionally.
Feast and Fettle in East Providence, Rhode Island is one of the businesses working with the Boston Public Health Commission on a pilot program to help moms with newborns by delivering fresh, nutritious meals twice a week to more than a dozen Boston families.
So knowing that they have this very nutritious meal to kind of help them through those first few weeks makes me really excited and really proud of the work we do here.
It's not just the meals helping out new moms, it's the services, supports, and resources all provided to help moms with their mental and physical health. Becky Cruz-Crossan is the division director of the Boston Public Health Commission's Healthy Start Systems.
We're a maternal child health program. We're a home visiting program.
When the conversation came up about how to better help moms, especially moms of color, postpartum, meal deliveries made sense.
This is saying, hey, we have you, we got you for the next 8 to 10 weeks, and here's why, right? So you can focus on baby, so you can focus on yourself while we kind of focus on you.
The goal is to make the pilot program permanent and to open it up to even more moms by reaching those who may need help most.
Making sure you have access, making sure you have resources, making sure that what's needed for you and your family to be well is made available.
In Jamaica Plain, Emily Maha, WCVB News Center 5.
So Dr. Bisola Ojikutu is back with us in the studio. The commission is very focused, of course, on maternal health, laser focused. How has that pilot program been received, and when will it continue?
Right. So it's been received extremely well. I think the pilot program not only deals with immediate needs, you know, the access to food, but it also connects people to services, and these are services that they may not have heard of. And so from those families who participated, we've gotten a lot of wonderful feedback, and we would love for it to continue. We're really just looking for money to do so and to expand it.
Yes, the rate of severe maternal morbidity in Massachusetts nearly doubled from 2011 to 2020, with black women experiencing the highest rate of complications. What are some of the contributing factors to these higher death rates, and what's being done? What more is being done to improve maternal health outcomes?
So I think that one of the major issues here is what's happening within our health system. Many birthing individuals and their families are not receiving the quality of care that they should be receiving. And even in a city where we have a plethora of healthcare resources, we have work to do. You know, there's certainly institutional racism, as well as just barriers to accessing, barriers to navigating the system, and compounded by the fact that there are also, you know, comorbid conditions that women are coming to the prenatal period with. And those are issues that, as we know, it relates to inequities and problems that we have just within our own communities and social determinants of health, like socioeconomic status, like poor housing. All of these issues compounded have made it a very difficult challenge for birthing individuals who are black in the city of Boston.
Surgeon General Vivek Murthy recently formally declared gun violence a public health emergency. The 4th of July holiday weekend in Boston was particularly violent, with separate incidents in different Boston communities. 7 people shot, 2 killed, but overall the city's homicide rate is down considerably. What factors account for this trend?
Well, I think it's complicated, but what I would say is that part of what's happening for us at the Boston Public Health Commission and throughout the city is that we're working in a very coordinated fashion, working very closely with the Boston Police Department and community policing, working closely with communities. Communities have solutions. They know where the violence occurs, and they know how to build on their strengths, and they know how to give good suggestions in terms of interventions going forward. So we're working very closely with communities to actually decrease violent incidents. And I do think that though it's important for us to acknowledge that homicides have gone down, this is not time for any sort of victory lap. We have a lot of work to do. We can prevent gun violence, gun homicides entirely, actually, in our city.
The Department of Public Health released data this year that said between 2015 and 2021, young people reported increased feelings of persistent sadness. That's an increase from 26% to 44%. What's the cause of this shift, Dr.?
So we've noticed the same thing here in Boston. And I think that what is happening is a number of things. One of them being that kids don't always have anybody to talk to who they can relate to. They need to have more behavioral health services, more mental health services that are easy to access, that are in our schools, that are easily available to them, and that they feel comfortable utilizing, that aren't stigmatizing, and people who understand them. And that's one of the things that we're working on very intensely at the city level. We've now invested approximately $21 million in a youth mental health initiative. Part of that initiative is working very closely with Boston Public Schools to essentially create trauma-informed schools so that everybody knows how to deal with trauma. All the adults within the school, as well as peers, can be involved too. So I think it's really important to work closely and meet people where they're at and be at spaces where kids are located. You know, I think another piece to this really looks at the issues of social media and what does social media do? Social media is a great tool, but it's also risky in regards to mental health and wellness. And so we have to be very careful, both as parents, as caregivers, as teachers, as people who care about kids, to monitor access. But again, I do think that social media can be a wonderful tool. We are using it. Social media campaigns, talking about mental health, trying to get kids to be open, to share their feelings. I think that's incredibly important.
The Surgeon General is calling for a warning label on social media platforms for young users, much like is found on cigarette packs. Do you agree that there's some kind of a need for a warning label? What's the concern and what's the benefit?
I do, 100%. I think that it raises awareness. It makes us aware that this is not a tool without risks. Again, social media can be used in a good way. You know, it gets information out there and we can use it in a positive way, and kids are not going to stop using social media. But we need to be aware of the risks of any tool that our kids, our growing minds, have access to on such an overwhelming basis.
What can parents do to combat the negative effects of social media?
They can talk to their kids. That's number one. And sometimes I think we try, but we aren't often good at it. You know, I have an 8-year-old sometimes, and she tries to get on social media. I don't necessarily allow that, but I think that sometimes we as adults, we don't meet them where they're at. And I know that sometimes people see that as a trite statement, but what I'm saying is actually talking about them about how was your day? What happened today? How did you feel today? And getting that feedback and limiting access to social media. You have to do it.
You're in charge.
Yes, 100%. I firmly believe that we as parents need to be in charge, especially amongst our youngest kids, in terms of how much access that they have to social media. We know that there's bullying that's out there. There are really some negative messages that are being disseminated, and we need to be careful about what our kids are exposed to.
Okay, up next, the health consequences of this intense summer heat. That's when Cityline continues.